Hello, welcome. So first off, I'd like to welcome everybody to the anti-menthol symposium. I just want to thank everybody for joining in the audience. My name is Austin Collins. I will be helping to facilitate a discussion today. We're going to be talking specifically about policy for this portion of it. I do want to remind everybody in the audience that we would like you to ask questions. So if questions pop in your mind, please feel free to write them in there. At the end of our panelist discussion, we will try to address some of those questions as they come in. But with that, I want to kind of introduce our panelists. We have a really top-notch crew today. So we have Naomi, we have Natasha, and we have Bob as well. And these are three specialists that have really been in the field for years and decades, have been working on different forms of tobacco control policies. So they bring with them a lot of insight and just a wealth of knowledge that they're going to share with us today. So just to start off, I think a lot of times when we do talk about menthol and we talk about flavored tobacco, there's a fair amount of confusion around that. The first question, just to get us going, I wanted to ask Natasha specifically, just why is menthol tobacco a social justice issue?
Thank you for that question, Austin. It's a good question. Menthol is reflective of the health disparities that we see in commercial tobacco, and commercial tobacco is a really huge reflection of health inequity in our country overall, because the tobacco industry is one of the first modern age big industries, right? So they have had an opportunity to practice every tool in the book and really set the tone for the rest of these industries that are doing the same things. So the tobacco industry has been one of the leaders on, preempting state and local governments from passing public health regulation, which we know tend to be more protective of public health. Now we are at a place where some communities who have the authority are actually taking action and saying no to menthol. This is a racial justice and equity, a health equity issue, because of the way that it's become the number one choice of Black people who do smoke. They choose menthol. It makes it harder to quit. It makes the addiction even stronger because you hold it in for longer. And for many reasons, it's just a very dangerous product. And it's the number one choice of Black Americans. And so because the industry caused the problem that's now killing and making ill so many of our Black family in this country, then we really need to say this is not a product that should be on the market. If it were introduced now, with the same marketing tactics, I guarantee you we wouldn't even we wouldn't have to prove this, because we would see it so much quicker.
I appreciate you just contextualizing that, just bringing forth some of that history, because I think a lot of times that's lost. Um, so I think that's so important, and also bringing up the research aspect of how it was that intentional, where there was research done, and then it was targeting the community specifically. Um, you know,
And Austin, I'm sorry, I just want to say a personal story for me, since we're going to kind of go back a little bit with the um, targeting and the research, is that, for a very long time, there weren't any Black spokespeople in the United States. When we're talking about product advertising and things like that, until the tobacco industry started using Jackie Robinson and these other athletes to actually have deals. These were spokespeople for Chesterfield cigarettes. My grandma actually smoked Chesterfield cigarettes, and she died of throat cancer before I was born. But I think the thing is to note about the racial justice issues that the tobacco industry knew what they were doing this whole time, in a very really insidious way, because what they were playing to is the attempted cultural genocide of Africans that were kidnapped and enslaved in the United States, and then also taking advantage of systemic oppression, knowing that, oh, okay, well, we know that this politician or this organization doesn't have the funding that they need. Let's go ahead and give them funding so that not only will we get credibility in the Black community so we can push menthol more, but also we'll be able to rely on these people to support a pushback against public health measures that maybe would, prohibit menthol, for example. So I just wanted to add that in because I'm glad that you also think that it's important to talk about the context.
Absolutely. Absolutely. And I think a lot of people are learning a lot, throughout this all the sessions today. Um, along those same lines, just talking about um, government and policy and what their role is to kind of safeguard these communities that have previously been targeted. So I just want to ask, Bob, I want to ask you this one. So as far as kind of nationally, what sort of prevention has occurred at a national level thus far?
Yeah, unfortunately, we've seen, very little action to address menthol, obviously. And historically, when you look at how tobacco has been addressed, the tobacco companies have pretty much controlled the federal agenda and most state agendas. And it's really where local communities will have led the way on trying to battle back against the tobacco companies. And sadly, the industry has very much controlled the federal agenda. Very little has been done over the years to really impact them to a degree that, and obviously around flavors in particular. When you look at, I think it's critical when you look at in 2006, the tobacco companies lost a federal lawsuit. They were convicted as racketeers by a federal judge. And in her opinion, it's very important. Not only did she say tobacco companies have basically lied about every aspect of their business, whether they were killing people, addicting people, targeting kids. She says, this is 2006. She says, not only did they do it, they haven't stopped doing it. And so that's critically important. And so move forward to 2009 when we had federal legislation that gave the FDA some authority to regulate tobacco. And that legislation banned flavors, not all, but banned flavors under the guise that it was to protect children. So after 2009, you couldn't sell peach flavored cigarettes or strawberry flavored cigarettes, but they exempted the flavor most used by kids, which is menthol. And I think someone correctly surmised that apparently the health of a black youth was a political bargaining chip. Because to exempt menthol was saying that we knew that menthol was used by most black youth. And exempting it was absolutely ridiculous and should never have happened. So part of that legislation was to then establish a scientific advisory committee to look at menthol. Well, there have been two scientific reports on menthol done, 2011, 2013. Both of them said the same thing. We know that menthol increases the addiction among kids. We know menthol makes it harder for people to quit. And removing menthol would be a benefit to public health. And yet, even with these comprehensive scientific reviews, done with the tobacco industry having the chance to try to put in their information to try to steer it in another direction. Even though we've had these two scientific reviews, even though, as Natasha mentioned, we have literally warehouses filled with tobacco documents that talk about what they knew about menthol, nothing has happened at the federal level to remove menthol. And so it's been insanely frustrating. Unfortunately, it's a long tradition that the federal government has not done a lot. The industry remains in control mostly of that agenda. And really, it comes down to local communities. We hope states would do more, but at the federal level, not enough has happened.
It honestly is a devaluing, right, of certain people at a systemic level, and so not honoring their inherent rights.
And really, if I can say one thing too, which is really important, is you know though all of us have heard for decades about let's address disparities. We need to address disparities. Well, we need to actually do something to address disparities. And as part of the first scientific report, there was a survey of black and white menthol users. And they found that half of black menthol users said at that time, if you remove menthol, they would quit. That would be one of the greatest public health campaigns we could ever imagine. Removing menthol could save countless lives, in particular among the Black community, and I think this would be one of our greatest opportunities to correct a disparity that existed for so long. So that's critically important when we look at menthol as well.
Absolutely. And it seems like a lot of inaction at this point on a national level. Shifting a little bit more to state and local level. Naomi, what policy work has been done and is still yet to be done to affect this?
That's a great question, Austin. So when I think about what has been done at the state and local level, I think a really significant piece of legislation was when the Colorado State Legislature passed a law that would take away what was previously in law, that would penalize local governments that enacted policy change that in the interest of their community that was more stringent than the state law. So if a community was looking to pass a law to raise the price of tobacco products, before 2019, they would lose their share of the state's tobacco tax, which was a big deterrent for a lot of communities to want to take action. There were some that said forgone that money and said we want to move forward, but many communities didn't. And so as a result of that legislation, we've seen communities across the state of Colorado take action to adopt evidence-based policies to reduce the harms of tobacco industry tactics, from raising the age of sale to 21 and ensuring that any business that wants to sell tobacco products is required to get a license to do so, which would create a mechanism for enforcement and ensuring that those businesses weren't inadvertently selling to those that were underage. We've seen communities that have chosen to end the sale of all flavored tobacco products, including menthol, in their communities because they want to put the health of their community above the industry's tactics and profits because they know it's the right thing to do. And we've seen many communities that have raised the price of all tobacco products, of which until Proposition EE passed in Colorado, there was not a statewide tax on electronic cigarettes and any type of electronic smoking devices. So, there's been such great impact at the local level of communities that have said we don't want to fall prey to the industry's taxes. We want to enact policies that's going to protect our community, that's going to help us bring in revenue to support cessation and prevention efforts, to ensure the next generation isn't becoming addicted to these products, and those that are unfortunately addicted have resources to help them in quitting. Those have been some really significant successes. There's still a long ways to go in getting more communities to adopt those types of policies, as well as to see action at the state level. But, we're fortunate in Colorado that because of the lifting of that preemption, we're in a place where there is opportunities now to act what's in the best interest of the community by passing community level policy change.
Absolutely. Yeah. It seems like there is a reinvestment, right, in our community and an acknowledgement by community members and representatives of the traumatic health costs, right, of menthol as well as other tobacco. Natasha, just along those same lines, because I know that Minnesota is one of the leaders in tobacco control policies. Is there anything else that you've noted that's been done at a local level or state level?
Yeah, I think California and Minnesota are leading the way as far as how many local governments. Massachusetts is a state that has quite a few jurisdictions, probably the most, but not those that cover menthol or are full bans. But still a lot of activity. Something to note about the local action is just that I think it's important that we're all on the same page about what they should look like and the way in which we engage the community when they're passed. Because as a lawyer, oftentimes being brought in, kind of towards either the middle or a little bit during the process, the Public Health Law Center can provide free legal help to any and all communities in Colorado if you are thinking about flavored tobacco regulation, a menthol ban a full flavor ban, you can contact us and we can help with language and talking through legal issues and things like that. And then also the Center for Black Health and Equity is a national organization. I'm on the board of that organization, but they have staff that can also help with the research, evaluation, community readiness, preparation component of policy as well. I say that because I think a lot of communities get really interested in a topic, and then if they don't have the communities most impacted by the policy involved from the very beginning, or if it's not led by those communities from the jump, there ends up being some issue that might come up down the line that they really can't respond to. So you need community support to pass a prohibition on the sale of all flavored products. You need to make sure that you have language that is in line with the constant approval that the courts have issued for these regulations across the country. And that's another thing I wanted to touch on, is that while we're really happy to see all this local movement, there have been some cases, but all of those cases have been favorable for public health so far. That includes, like in the beginning, the flavor sales regulations that were only for some flavors, for some products, and in some spaces, right? And so now we've evolved from a very limited flavor tobacco sales regulation that prohibited the sale of flavored, e-cigarettes, but not menthol, or the flavor of combustible products, but not menthol and not e-cigarettes. So they're like variations of those, but the trend now is that communities are either completely prohibiting the sale of flavored products, and that's for many different reasons, because it's difficult to enforce when you have some exceptions. You know that the government's not going to go back and touch the tobacco ordinance for several years, all of these things. Or the other trend, if they can't get a full ban, is to pass a flavored tobacco restriction that applies to all products, all flavors, but you do exempt like tobacco product shops, which most people refer to them. These are like vape shops or cigar bars or tobacco shops that sell about 90% of their revenue is coming from the sale of commercial tobacco products. Some are still exempting those types of stores.
What does it look like? What does good community engagement kind of look like?
Yeah, and I welcome the work happens much earlier than when the actual policy is introduced. So really trying to organize community leaders, those that are most disproportionately impacted by the toll of tobacco, and specifically those communities that have been targeted for so long, and trying to understand the issue we're trying to solve. So really trying to deepen their understanding of the industry's predatory practices in relation to how they have tried to co-opt the culture to help in building their business practices to actually sell to the Black community and other communities most impacted. And I think that's a great tool to help understand the severity of the challenge, but also help them get excited and fired up to do the work. Also really deepening, communities' understanding of the toll that tobacco plays, not only from just a health perspective, but truly, what does that health perspective look like as we think about chronic diseases, loss of wages because of, inability to work, taking time off of work, all of those kind of factors. And I say all that, and that truly having a deep understanding of the issue will really help in speaking to the why and the why now to decision makers, other community leaders and influencers. And that work takes time, especially as we think about, I think more and more now people are making that connection to this work in relation to social justice and inequity and whatnot. But we want to ensure that those leaders that are making these decisions have that deepened understanding too, especially when we think about why an exemption is not the way to go, how you're leaving certain communities behind when you do consider exemptions. You're creating more challenges for an enforcement agency to actually regulate the work. And, it can inadvertently, to Natasha's point, bring about lawsuits and other type of litigations that communities are not necessarily in a financial or capacity space to actually to fight and continue to try and address to keep that law that they've worked so hard to pass in place. So I think having that deep-rooted understanding and having community, understanding the industry's tactics, what are the best ways to speak to the why now, how to pivot in your messaging, when you're talking to decision makers or the media or other folks, can really help to build a great foundation. But then, the next step is organizing and building that public will and community support for policy change and trying to bring about all of the different stakeholders. So beyond public health and community, who are leaders from the faith-based space, who are leaders that are working on other social justice issues that can embed this work into their advocacy efforts. And bringing all of those different stakeholders and sectors along can go a really long way, to that point when you are ready to move forward with the policy. I'd say the last thing too, and then welcome my other panelists to share, is just finding a strong champion, somebody who is with you and gets all of these pieces around why exemptions should not be on the table, why this is a social justice issue, why action is needed now, and someone that, having somebody that is steadfast in their position on that can go a really long way to ensuring success.
Absolutely. And Bob, I see you shaking your head there. I know you've done decades and decades of work on this. How do you keep that momentum going, and what else would you add to that?
I think my co-panelists did a wonderful job really outlining the critical pieces, which is, I think, and I think one of the critical pieces too is was mentioned, no community is too small for the tobacco companies to intervene, because tobacco companies know local communities have a lot of power and a lot of influence. And what they want is either to kill your policy, or if you pass a policy, they want it to be a weak policy that they again will then take to the next community and say, here, you can do this weak policy and not that strong policy that other community did. So they're always, Martin Luther King spoke to the intoxicating drug of gradualism. And, to avoid that is to watch out for those, well, we don't have to ban menthol, maybe we could do something different, or maybe we could exempt some stores. No, I think that's what, we have communities that have taken comprehensive action to remove all flavored tobacco products, whether it's in e-cigarettes or other products. And so it's critically important that the industry is going to play, because if the industry is active, it means it's going to impact their profits, and it's probably good for public health. If the industry's mad, it's going to be good for public health because they're fighting it to protect their profits, not public health. And it's critical that the public and the advocates, everyone sees themselves. It's really up to you to stand between your community and the tobacco companies. And if you don't, the tobacco companies will get in. They will try to find people in your community to show up and give, to pretend that they have some sort of grassroots support. But it's critical that we build that grassroots support, that you really anticipate the industry coming. As Natasha said, access those great comprehensive legal resources to write a good law. And as Naomi said, build that good coalition, and you'll win. You just have to be ready for a battle, but you'll win. And in the end, of course, you're going to protect a lot of lives, save a lot of lives.
Absolutely. I love it. That's impassioned. And Natasha, is there anything you'd add to that?
I mean, there's so many ways you could talk about it, and there are so many resources out there to help with that. One of the biggest trends I'm seeing right now are young people, and really people of all age, but especially young people I've seen be really interested in the idea of working with other environmental justice activists in the fight for flavored tobacco, and really actually the end game policy for tobacco, because 100 cities, including the city of St. Paul, which is just across the river from me, here in Minnesota, pledged to be significant reducers of plastic marine pollution in the Mississippi. And so the idea there is to literally, the goal is to pass ordinances and policies that would reduce the amount of plastic pollution that enter into, in the community's waterways, that would eventually enter into the Mississippi. We know for a fact that cigarettes, and the microfiber and plastic in cigarettes is non-degradable. It's a huge, if not the top plastic pollutant in most waterways across the United States. If we reduce the sale of commercial tobacco products, whether it's because no flavored tobacco products are available or all products, you just outlaw the sale there, Because it hasn't been done, there's not a study to show what would happen, but you can imagine that the reduce in access to tobacco products would reduce the amount of plastic pollution in that jurisdiction. And so it's just something to think about, something to engage with the community on, that it's even just more than just talking about all the issues surrounding menthol, but it's a human rights, civil rights, justice issue. So that's what I've
Sure.
had.
I appreciate the passion. I can tell. I mean, it sounds like the intersectionality of everything. It sounds like this is a social justice issue, a human rights issue, like you were saying. Um, and another key takeaway from you guys is just the education factor. Just making sure you have that knowledge, making sure you're knowing what these corporations and these companies are literally selling to you, and then knowing the historical context as well. That knowledge equates to power. Um, and then I also heard the mention of no community is too small, right, to start this work, and just making sure that it's a wholehearted effort where you have comprehensive language, and you get ready for the battle.
The first jurisdiction in the entire country to pass a full ban on all flavor products was Yolo County, which is a county in California that has very low population because a lot of the surrounding areas incorporated. And so San Francisco often gets the glory for the full flavor ban, but actually Yolo County went first. It's just that there wasn't really a large population.
Wow.
So these types of bold policies can happen in places outside of big cities and big county budgets and things.
Wow. I know you guys have so much passion. I know you could keep talking. Unfortunately, we have limited time today. I just wanted to give a little more space if there's any kind of last minute thoughts or advice that you'd give to community about tobacco control policy. And this is for anybody.
I would just say that the critical importance of when I would speak to local advocates is understanding that your work is generational. If you take action today, you're not just saving lives of today, you're saving lives of people you will never see, never meet, and generations of people you'll never see or never meet. So this is an opportunity not just to protect the kids and adults of today, but think about in those states where we have smoke-free bars and restaurants. Well, a kid today grows up not even knowing, many kids grow up thinking there was never smoking in a restaurant or bar to begin with. And that's what we want them. And there will be generations of kids who are going to grow up and never knew of flavored tobacco products. I mean, that's the importance of this work. It's not just helping today, but it is truly something that will carry on for decades. So I just encourage local communities to take action. And again, if you don't act, the tobacco companies are going to act. So
Absolutely. Any other final thoughts?
I would just add, there's so much power in community voice and action to help lead efforts that will impact, to Bob's point, generations to come. For me, I'm personally impacted by the toll of tobacco, and that's what keeps me going in this space of work. And it is challenging, it is grueling, it's getting harder every day, but that doesn't make it any less important. And we're in this critical moment where local decision makers, state decision makers have the authority and ability to act. There is a movement around addressing injustice that have been perpetuated for decades in this country. And, the work of the tobacco industry is an example of that. And so we all have an opportunity to do what's right and in the best interest of our community. And this work is so critical. And I just encourage you all, there's ways for you to get involved. There's ways for you to elevate the need to have evidence-based policy change. And so I just want everyone to see the impact that they can have in their community in elevating this issue and taking action.
Yeah, and I'll just add two things. Number one, it's just the language is very important. So I just don't want to, I keep talking about the language as a lawyer. It's very important to me, but it is also really important that all of this hard work that we're talking about happening for community engagement and support and all of the feelings of, being heard and seen and that community that gets built, you want all of that to be memorialized in something that is going to last, that is going to actually do what it was intended to do, and not have to defend it, or maybe get to a point where you can't defend it anymore in court. So that's why I talk so much about the language. So I again would just encourage you, it doesn't have to be difficult. It can just be a matter of getting connected with people who can help you with that. And then the second thing I want to say is just a reminder to remember that this is a racial justice issue. This is a justice issue on many fronts. But there are so many things that we can pull in to strengthen the flavored tobacco regulation. We mentioned some of them on the panel today. My panelists did as well. But another thing to keep in mind is that a lot of communities are moving, I know in Colorado as well, on racism as a public health emergency. And so if there's a way for you to get involved in these other ongoing efforts to address equity in general, and to make sure flavored tobacco is plugged into any action items, because some communities are really just adding things to lists of things to do in order to address inequity. And so sometimes that can be a good wave to ride as well. So just being creative and allowing the community to provide input about how it should be done and what it could look like.
Absolutely. Well, I appreciate it. I hope everybody's taking notes and stay engaged, is by far the biggest takeaway. I do want to thank all of the panelists here. I want to remind everybody in the audience that you can continually submit questions, and we'll do our best to direct them and to get an answer for you.